In the revised measures set to contain the spread of the COVID-19 pandemic, the curfew was lifted. However, nightclubs, live bands, bars, reception and betting activities shall close at 2 a.m. Some residents say this is good news.
Usually at 10 p.m. I start to think of going home and reach at 11 p.m. because most of us live far. We used to work in a rush so that we can go home early. Now we are going to work hard and even work the whole night for those who want it. This will increase the amount of money we used to earn. Some of us who do businesses of wholesale trade, going back and forth, be it men or women, this is going to increase our income. We are going to buy different products and sell them in a short period of time and get enough income.
Among the people that rejoice because of this news include those who do public transport in Kigali city because they were not allowed to transport 100% of the passengers they should transport.
We used to transport seated passengers only. We used to see people at bus stations waiting for buses, but we are not allowed to take them. We would leave them waiting. They used to beg us, but we couldn't help because of preventive measures. We only transported those who are seated.
Residents say this should not be a reason for people to be complacent.
We are now allowed to do our activities freely, but that doesn't mean that coronavirus is gone. We should behave well and do our best to contain the spread, because this pandemic has affected our development.
The Minister of State in the Ministry of Health, Dr. Tarsis Munga, notes that the measures taken are based on the analysis done.
Current measures have been taken based on the assessment the Ministry of Health have conducted across the country, where the incidents have significantly reduced. We are below 5 cases by 100,000 people, which means we are in a lower incidence rate. So this incidence or the number of people who are infected compared to the total population is very low, so which allows people to continue to move and to open other activities at a large scale. We will continue to increase also to vaccinate people, first, second, and the booster dose, to also to give them the immunity for them to continue to be more strong in terms of resistance of the human body.
The Minister of State of Local Government, Jean-Marie Vianney-Gatabazi, notes that all efforts made is to help people engage in their work and not be affected by the effects of the pandemic.
Those who do agriculture products continue to farm and they got the productivity, and this reduced hunger, but many trade activities were affected. This is why we lifted the curfew. It was decided that borders should reopen and allow public transport to work at its full capacity. Those who do private transport are ready. From Monday, they will start transporting local passengers as well as foreigners, and they will also bring tourists.
Simplifying the measures will go hand in hand with sensibilizing people to vaccinate themselves because the number of people with the third dose are still few. This will help to contain the spread.
The number of people who have 2 doses of the vaccine are 7.8 million. Those with 3 doses are 1.8 million. People with both doses but don't have the booster shot are not allowed to participate in different activities, such as attending church services, weddings, and other gatherings. They have to take the booster shot, and there are still many of them, yet we have the vaccines. Local authorities, priests, and those who organize different ceremonies should tell people to take the booster shot because they won't be allowed to gather.
Borders also have been opened, so the movement of people across the country and the neighborhood we're going to increase. So we be more focused by putting first teams at border to make sure that now we are following and making surveillance, testing on a regular basis, and also vaccinating people who are eligible to make sure that now we are cutting down the transmission rate.
The Ministry of Health notes that they will continue testing people in various parts of the country, which will help in determining the status of infection and help in taking other measures. Ntete, RwandaTV News.